Hello everyone, and welcome to Health Tips with Dr. Yava. I'm Dr. Yava, and today we're going to talk about a very important topic: ways to effectively prevent pregnancy. Whether you're looking to delay starting a family or simply want to take control of your reproductive health, understanding your options is crucial. So let's dive right in and explore together. Our first method is one you might already know about, the pull-out method, also known as withdrawal. This method has been used for centuries and is one of the oldest forms of contraception. This method involves the male partner withdrawing his penis from the vagina before ejaculation. The idea is to prevent sperm from entering the vagina and fertilizing an egg. Now, while this method might seem appealing because it requires no devices or medications, it's important to understand that it's not the most reliable. Many couples might choose it for its simplicity and spontaneity, but there are significant risks involved. You see, even before ejaculation, a small amount of fluid called pre-ejaculate is released, and this fluid can contain sperm. This means that sperm can be present even before the male partner fully withdraws. This means that even if withdrawal is timed perfectly, there's still a chance of pregnancy. The risk is always there, and it's something couples need to seriously consider. In fact, studies show that the pull-out method has a higher failure rate compared to other methods we'll be discussing. The failure rate can be as high as 22% with typical use, meaning 22 out of 100 couples using this method for a year will experience an unintended pregnancy. So, while it can be an option for some couples, it's crucial to be aware of its limitations and potential risks. Consulting with a healthcare provider can help couples make more informed decisions about their contraceptive choices and find a method that best suits their needs and lifestyle. Let's move on to a lesser-known method called the cervical cap. This method is not as widely known as other contraceptive options, but it offers a unique approach to preventing pregnancy. Now, the cervical cap is a small, reusable cup made of silicone that's inserted into the vagina to cover the cervix. It's designed to fit snugly over the cervix, creating a barrier that prevents sperm from entering. It works by blocking sperm from entering the uterus, thus preventing fertilization. This physical barrier is a key component of its effectiveness. Before inserting the cervical cap, it's important to apply spermicide to further increase its effectiveness. The spermicide acts as a chemical barrier, killing sperm on contact. The cervical cap can be inserted several hours before intercourse and should be left in place for at least 6 hours afterwards. This allows for flexibility and spontaneity in your intimate moments. While it can be an effective method when used correctly, it's crucial to consult with a healthcare provider to ensure it's the right fit for you. They can assess your individual needs and provide personalized advice. They can help you choose the correct size and provide guidance on proper insertion and removal. Proper usage is essential for maximizing the effectiveness of the cervical cap, so don't hesitate to seek professional help. Now, let's talk about those just-in-case situations. We've all been there, right? Sometimes unexpected things happen, and that's where emergency contraception comes in. Emergency contraceptives, often called the morning after pill, are medications designed to prevent pregnancy after unprotected sex or contraceptive failure. Now, it's important to remember that emergency contraception is not intended for regular use. It's meant for those occasional situations where your primary method fails or wasn't used. These pills work by delaying or preventing ovulation, and they're most effective when taken as soon as possible after intercourse. The sooner you take it, the better it works. Emergency contraceptives are available over the counter in many places, so you can access them easily when needed. Chapter 4. Contraceptive pills. Moving on to one of the most popular and effective methods of contraceptive pills, also known as birth control pills. These pills are taken daily and work by releasing hormones that prevent ovulation. By preventing ovulation, they effectively stop the release of an egg, making fertilization impossible. Contraceptive pills are highly effective in preventing pregnancy when taken correctly and consistently. However, they do require a daily commitment to maintain their effectiveness. Missing even one pill can increase the risk of pregnancy. It's important to choose a pill type and schedule that best suits your lifestyle and preferences. Chapter 5. Implants. Let's explore another long-acting reversible contraceptive method, implants. Implants are small, flexible rods that are inserted under the skin of the upper arm. Don't worry, the procedure is quick and relatively painless, usually done under local anesthesia. Once inserted, these implants release hormones into the bloodstream that prevent pregnancy. And the best part? They can last for up to 3 years, providing continuous protection without the need for daily attention. Implants are a highly effective and convenient option for those who prefer long-term contraception without the hassle of remembering to take a pill every day. Chapter 6. Condoms. Now, let's talk about a method that not only prevents pregnancy but also protects against sexually transmitted infections: condoms. Condoms are a barrier method that physically prevents sperm from reaching the egg. They're made of thin latex or polyurethane and are available for both men and women. Male condoms are rolled onto an erect penis before intercourse, while female condoms are inserted into the vagina. Condoms are a popular choice for several reasons. They're readily available without a prescription, affordable, and easy to use. Plus, they offer that added layer of protection against STIs, making them a responsible choice for sexually active individuals. Chapter 7. Hormonal injections. Another effective method of contraception is hormonal injections. These injections, such as Depo-Provera, are administered by a healthcare provider every 3 months. So instead of taking a daily pill, you get an injection once every 12 weeks. These injections work by releasing hormones that prevent ovulation, similar to contraceptive pills. Hormonal injections are a good option for those who prefer not to deal with daily pill taking but still want a highly effective contraceptive method. However, it's important to be aware that hormonal injections can have side effects, such as irregular bleeding or changes in menstrual flow. Chapter 8. Abstinence. Finally, let's talk about abstinence. Abstinence simply means choosing not to engage in sexual activity. It's the only method that is 100% effective in preventing pregnancy and sexually transmitted infections. Now, while abstinence may not be a practical choice for everyone, it's an option to consider, especially if you're not ready for the responsibilities of sexual activity or want to completely eliminate the risk of pregnancy and STIs. It's a personal decision that should be respected and supported. Remember, it's important to choose a method that fits your lifestyle and health needs. Each person is unique, and what works for one individual may not be the best option for another. Take the time to research and understand the various methods available. Consulting with a healthcare provider can help you make the best choice, taking into account your medical history, preferences, and any potential risks or side effects. They can provide personalized advice and answer any questions you may have, ensuring you feel confident and informed about your decision. It's also worth noting that combining methods, like using condoms along with another form of birth control, can significantly increase effectiveness and provide dual protection against both pregnancy and STIs. This approach can offer peace of mind and an added layer of security. If you have any questions or topics you'd like me to cover in future videos, please leave them in the comments below. Your feedback is invaluable and helps guide the content we create to better serve your needs. Don't forget to like, share, and subscribe to Health Tips with Dr. Yava for more valuable health information. Stay healthy and informed. Sharing this content with friends and family can also help spread awareness and promote healthier choices within your community. Until next time, I'm Dr. Yava, and this is Health Tips with Dr. Yava. Take care. Remember, your health is your wealth, and staying informed is the first step towards a healthier life.